Hello, in this video, I'm going to talk about chronic obstructive pulmonary disease and exercise recommendations. So chronic obstructive pulmonary disease, or COPD, is when airflow is obstructed and it's caused by chronic bronchitis, emphysema, or asthma. So I'm going to talk all about asthma in a separate video. So here I'm really going to focus on chronic bronchitis and emphysema. So chronic bronchitis is when somebody has a cough on most days for 3 consecutive months in each of 2 successive years. So it's just a chronic cough that doesn't go away. There's excessive sputum production, and it lasts for months and then comes back or persists, for a couple of years. So it could be for 3 months and then it's gone for 9 months and comes back again for another 3 months, then that would be considered chronic bronchitis. Emphysema is abnormal permanent enlargement of the respiratory bronchioles and alveoli. So the alveoli, like the little air balloons inside of our lungs that fill up with air, they are elastic. So when they fill with air, they're stretching out like a balloon. And then because they're elastic, they will recoil, and that helps push the air back out again in exhalation. So in emphysema, it's sort of like those little alveoli get stretched out. And so they permanently are overstretched so that they lose that elastic recoil. So somebody with emphysema can inhale and inflate those alveoli just fine, but then they have difficulty pushing the air back out again. They have a hard time with exhalation because the alveoli are like floppy instead of being nice and tight and elastic. So that elastic recoil is not helping to push out that air. So there's a reduction in airflow and more work for the muscles of exhalation, because instead of those alveoli just sort of passively helping to push the air back out again due to the elastic recoil, instead you need your muscles of forced exhalation to pick up the slack. So it's really exhausting on those muscles. So it causes hyperinflation of lungs and flattening of the diaphragm. Cigarette smoking is the primary risk factor for COPD, and it reduces the forced expiratory volume, meaning the amount of air that you can breathe out in forced exhalation. So when you force it and you push out as much air as you possibly can, someone with COPD will not be able to exhale as much as somebody with healthy lungs. It also causes skeletal muscle dysfunction, likely because there is not enough oxygen being circulated to the muscles throughout the body. So somebody with COPD, they're not doing a great job of clearing their carbon dioxide and taking in oxygen and then being able to distribute that throughout the body to all the different tissues. So not being able to clear the carbon dioxide leads to increasing acidity in the blood, because breathing out carbon dioxide is one of the main mechanisms that we use to clear our hydrogen ions, which as they increase, it's increasing acidity. So that's one of the systemic problems here. But then also we end up with hypoxemia, so not enough oxygen in the blood. So when the blood is being delivered to muscles and other tissues, they're not receiving all the oxygen that they need. So we end up with sort of detraining effects. So we lose muscle strength, and we actually have a reduction in the type 1 fibers that are more oxygen dependent. And we have an increase in type 2 fibers, probably due to the hypoxemia and to lack of physical activity in general. So treatment, number 1 is stop smoking. And that is the number 1 cause of COPD in the first place. So it is important to stop smoking. And then many patients will require oxygen therapy. So it's hyperoxygenated air that they're breathing in so that they can extract more oxygen in their lungs. And then there are pharmacological therapies depending on the specific presentation of the patient. And then pulmonary rehabilitation is a multidisciplinary intervention. So there'll be different therapies, different types of practitioners, and that can include exercise therapy. So exercise recommendations in COPD. So lower extremity aerobic exercise at least 3 to 5 times a week. And that can mean like a stationary bike or something like that. So where you're getting aerobic exercise, but really using the legs primarily for that activity. You want to aim for 20 to 60 minutes per session, but you might have to start lower than that and build up to that. Work at 11 to 14 RPE, or you can monitor it by how they feel about their breathing. So if they're having difficulty breathing, and you want to stay where they're rating the difficulty between a 4 and a 6 on a 10-point scale. So if they start saying 7, 8, then that's time to take a break. Heart rate is not a predictable indicator of intensity. So in COPD, because they are not oxygenating their blood very well, that means that the heart is going to beat faster because it's trying to oxygenate the blood faster and distribute more blood to the body faster. So the less the blood is being oxygenated, the faster the heart is going to beat because it's trying to make up for the lack of oxygen. So heart rate will be high no matter what, and is not a predictable indicator of how intensely the person is working. Then you can also do ventilatory muscle training. So that's where you use specific exercises to try and strengthen the respiratory muscles. And then whole body resistance training. So regardless of age, you want to do 1 to 3 sets of 8 to 10 different exercises in each session. And if they're under 50, then aim for 8 to 12 reps per set. And if they're 50 or older, aim for 10 to 15 reps per set. All right, thank you for watching, and I'll see you in the next video.